కార్డియాలజీలో ఆధునిక సాంకేతికత గణనీయమైన మార్పులు తీసుకురానుందని డాక్టర్ దేవి ప్రసాద్ శెట్టి తెలిపారు. రోబోటిక్స్ వైద్య రంగంలో ఎంతో మేలు చేయగలదని విశ్వాసం వ్యక్తం చేశారు. కృత్రిమ మేధ వైద్యుల పనిని మరింత సులభతరం చేయబోతోందని తెలిపారు డాక్టర్ దేవి ప్రసాద్ శెట్టి.
Private health sector a solution for the problems of the poor in India?
You see, you look at most of the problems of poor are addressed by the private sector. You look at the cost of everything what people pay in India has come down dramatically in the last 30-35 years. I see about 60 to 100 patients every day, and most of the patients I treat are working class and poor people. 35 years ago, when I started my practice in Calcutta, then in Bangalore, every patient begs for help saying that he is poor, he has no money. And I needed to judge on how much money they can afford to pay on certain criteria. So the criteria I used to have those days was looking at the clothes they wore. If they wore very shabby looking torn clothes, I knew they are poor. But gradually I noticed that poor people in India also started wearing very good clothes. So my criteria of looking at the clothes to know whether somebody can afford to pay or not, that got lost. Then I started looking at the mobile phone. Those days feature phones were there. If a patient came with a feature phone in his pocket, I knew that he can afford to pay some money. After a while, everybody started coming with their phone. So I lost that indicator as well. Then I became smart. I said, all right, if they have a smartphone, they can afford to pay some money. But over a period of time, everybody started having a smartphone. So I couldn't differentiate who can afford to pay or not. Who brought about those changes? First, government came up with the right policies. Today you see so many good people becoming wealthy.
Sir, what is the one policy change you want the government to do immediately?
Okay. See, I do not have much knowledge about a lot of things happening in this world, but other than my profession of healthcare. First of all, I want to thank the Prime Minister for making an announcement that India will add 75,000 additional medical seats in the next 5 years. That can be truly a game changer, because India is short of nearly 2 million doctors. So having additional 75,000, but my request is this entire 75,000 seats should be owned by the government, and allotment of the seat should be done by the government, and the fee should be sufficient that working class families can send their children to medical college because of the fee is affordable. That will happen if the government changes the regulation on medical education by allowing large hospitals with over 500 beds to become a medical college, but the college doesn't control the student admission and the fees. It is the government controls the fees and the candidate selection. When that happens, we would have transformed the healthcare of the country. The reason is today medical education is so expensive that the children from poor families have stopped dreaming of becoming doctors. That has to be restored. Children from poor families must dream of becoming doctors. That will happen if the government controls all the admissions to medical colleges.
So what are the latest medical technologies happening in the field of cardiology?
See, the robotics are going to transform virtually every surgery we perform. Today they are expensive and only limited number of surgeries are done. But it is a matter of time before robotics will transform most of the surgeries. And also the entire, the biggest problem India is facing, like India requires 70 million surgeries and India is doing about 20-25 million surgeries. And if the surgical number increases in India, healthcare will get transformed.
You have said many times that people have complicated the natural art of healing. And what is your way to solve it inexpensively?
Today, most of the diseases people suffer from, they are called lifestyle diseases. Because of your lifestyle, you suffer from a disease. Example, diabetes. Generally, the cause of diabetes is obesity. Obesity is one of the biggest problems. And the obese people are vulnerable for diabetes. They are vulnerable for blockages in the heart. They are vulnerable for a fatty liver. Multiple problems. Now, this is caused by the people themselves. And very little exercise or anything to keep yourself fit is done when you are young. That is the second problem. Added to that, we have a very high incidence of smoking and chewing tobacco. India has the highest incidence of head and neck cancer. And that is only due to tobacco consumption, predominantly due to tobacco consumption. So essentially, we have brought these problems on ourselves.
Sir, once telemedicine has generated a lot of interest in addressing the issues of healthcare in rural areas, but looks like interest died down.
So telemedicine did not become popular because there was no technological means of transferring the data of the patient to the doctor. Today we have all those technological tools. So now it is in a time, it will take off in a large scale.
With the advent of artificial intelligence, how do you envisage the future of healthcare, especially in our country?
When you say doctor is able to diagnose, what do the doctor do? They will go through all these, your signs, symptoms, lab reports, look at few thousand data. Then the doctor will come up with the diagnosis. And human mind cannot decipher more than 10, 20, 30 data points at any given time. Whereas the artificial intelligence, all these tools, they can decipher millions of data points at any given time. So definitely they will be able to that will make me more effective to the patient. I don't look at telemedicine, the artificial intelligence as a threat to my existence. I look at it as a tool to make me much more powerful than what I am today.
Okay. Thank you, sir. Thank you very much.
Thank you so much. Thank you. Thank you.